once I almost hit 40, it's just the weight was just not coming off like it easily did, you know, when I was younger. And so I had been hearing about these peptides, and I found Tana.
Now, I think a lot of women can relate to Lori Sievert. It gets harder to keep weight off as we age, and many, like Lori, have turned to weight loss drugs, specifically these newer GLP-1 drugs like Ozempic and Mounjaro. Those are the brand names. Those can cost upwards of $1,000 a month and usually are not covered by insurance. So enter an alternative. Compounding allows medical professionals to get an active ingredient of a drug and mix it with something else. So this is done with lots of drugs, not just weight loss, but with GLP-1 drugs, sometimes they mix it with vitamins or other peptides. The FDA allows compounding when a drug is considered to be in shortage. The products themselves, though, are not FDA approved. Now, if you Google GLP-1 in Denver, you can easily find dozens of providers like medical spas offering these compounded versions. But now the FDA says the shortage is over and has ordered these providers to stop, and soon, April 22nd. Tana Donaldson with Redbud Medical Spa in Denver tells me that stopping this service will have a negative impact on her patients.
It's not just losing 25 pounds, it's the pre-diabetic who gets to never be diabetic, who goes back the other direction. Someone with hypothyroidism who's now off of their meds. People with autoimmune issues, chronic inflammation, joint pain, heart disease, you name it.
Now, again, the FDA is ordering this stop because of the shortage being over, but it's worth noting the FDA has reported some adverse effects of the compounded versions, mostly involving incorrect dosing. Donaldson says she does understand the FDA's focus on safety.
They are trying to shut down the bad actors because they do exist. There are online companies, there are supplement shops, there are places that are selling things that are not proven to be safe or efficient. And they don't come with a certificate of analysis where you know the source of this white powder that it is safe and it is efficient. Patient safety is of utmost importance.
Yeah, it's not exactly clear right now if providers will cut off access next week because there is a lawsuit pending against the FDA filed by the Outsourcing Facilities Association representing many of these providers. When I reached out to the FDA, a spokesperson sent me a statement essentially saying that they're going to wait on the outcome of that lawsuit before they would take any action. Either way, if you've been using compounded versions of these GLP-1 drugs, you should talk to your provider.